Hello friends, I am Dr. Priti Mehta, a senior consultant working at SRCC Children's Hospital managed by Narayana Health. I work as a senior consultant in Paediatric Haematology, Oncology and Bone Marrow Transplant. We all know that September is the Childhood Cancer Awareness Month and 13th September is celebrated as the Childhood Cancer Awareness Day. And so that's why I have come to talk to you regarding the same. Now, we come across a lot of children with cancer. And so I thought that I will address those issues which are pertinent in the parents' minds when a child is diagnosed with cancer. I am addressing the common questions asked to us by parents whose children are suffering with cancer. The incidence of childhood cancer is not much. If you look at the global perspective, it's around 4%, that is 4 lakh children globally suffering with childhood cancer. In our country, it is around 50 to 60,000 children per year. But for the children, it is a major problem because these are the future generations of our country and they need to be treated well for the society to be benefited at large. When we look at the age, the less than 15 years, the leukemias, lymphomas and the CNS tumors are the most common childhood cancers, followed by the neuroblastoma, which is another solid tumor. And in the adolescent age group, Hodgkin's lymphoma, epithelial cancers and germ cell tumors predominate. So you are not responsible for your child's cancer. It is not something that you have done wrong because of which the child has got cancer. There are a lot of contributing factors, be it genetic, environmental, lifestyle, passive smoking in the house, but nobody has been able to pinpoint a particular factor which causes the childhood cancer. You could not have done anything to prevent the childhood cancer, but definitely you can be a little more vigilant so that you seek help as soon as the symptoms come up. And the symptoms can include anything which is like unrelenting fevers, weight loss, which is quite significant. There are petechiae, ecchymosis, that is bluish black spots all over the body. There is a lump that you feel anywhere in the body. When the child complains of pain in the abdomen, don't take it lightly. When the child complains of backache, not to take it lightly because children normally don't have backache like adults. And so neuroblastomas can give rise to backache or other tumors can give rise to backache. And so you need to be a little more vigilant in those cases. Also, if the child is complaining of, it's a neonate or it's an infant and the child has a white reflex in the eye, you should not take it lightly. You should seek help immediately. So there are certain things where you need to seek help immediately. Children normally have growing pains, but the growing pains are usually in the night and the child needs to get up at night because of that pain, because the pain is very excruciating. However, in blood cancer, that is a leukemia, the child is going to have persistent bone problems and pains. So that is how you differentiate it from a growing pain and you should not take it lightly. Blood cancer, the commonest question that we are asked is that what stage of blood cancer is it? As we know that the blood flows through all the organs of the body. So blood cancer does not have a stage unlike the solid tumors. The solid tumors do have a stage. And in solid tumors, the stage 4 is when the tumor has spread to various parts of the body. But the blood cancer does not have a stage per se. And so that's why it is very, very important to get your children at the earliest, as soon as you observe any signs or symptoms. Because then if it is a solid tumor, it can be picked up in an earlier stage and the treatment will be different from a stage 4 solid tumor. But blood cancers don't have any stage. So there is a very likely chance that certain children, though a small fraction, may relapse while on chemotherapy. The B leukemias or the T ALLs or the acute myeloid leukemias. But then there is always a hope because as a second line treatment, bone marrow transplant can be offered. And now currently even CAR T therapy is available in our country. So we do have options and there is no, it is not the end of the story. So you should not lose hope about the child having relapsed because we can offer other therapies which are there in our armamentarium. Bone marrow transplant can be offered to children who have relapsed with leukemias, acute myeloid leukemias or acute lymphoblastic leukemias, the high risk ones. It can also be offered for certain solid tumors like the stage 4 neuroblastomas or the relapsed Hodgkin's lymphomas. This will be an autologous transplant that we would be doing. Apart from that, the bone marrow can be also offered for benign hematological conditions like thalassemia, sickle cell anemia, aplastic anemias, and immunodeficiency syndromes. For immunodeficiencies, the only curative treatment is bone marrow transplant, and that includes a wide range of spectrum of diseases like primary HLH or Viscott-Aldrich syndrome, severe combined immunodeficiencies, common variable immunodeficiencies, and many more. So bone marrow transplant, it can also be offered for certain metabolic conditions like Hurler's syndrome, Gaucher's disease. So it can be offered across a wide range of disease spectrum, and I treat all of these children, all these conditions with bone marrow transplant. So I would like to conclude that childhood cancer is treatable. The prognosis is good if the children are brought on time, if the parents follow the instructions very well and get the children timely for their chemotherapy sessions. And even if the child relapses, bone marrow transplant, CAR T therapy is now available. So there is nothing to get disheartened. You cannot prevent, but definitely you can treat children with childhood cancers. Thank you.